Professor Alfred, your turn.
Thank you. Thank you very much. So what I'll be talking about is electromyography, or as we know it, EMG, which is a diagnostic modality that is used in a lot of professions, but in my opinion, in podiatry, it is still very, very far from being utilized on a regular basis. So EMG, electromyography, what is EMG? And what does it do? EMG provides access to all those physiological processes that causes the muscles to generate force and produce movement. And as we know, when we walk, there are a lot of muscles which function either together or one muscle after the other. And EMG allows us to visualize these activations. As one of the pioneers of EMG, of electromyography, has said, DeLuca, electromyography is very easy to use, and consequently, it is very easy to abuse. So we must be careful that whatever signal we get from EMG is actually the right signal, and as we'll see later on, we're not looking at some other information which might not be relevant to our project or to our clinical use. So basically, as we know, our muscles they function differently throughout the various phases of the gait cycle. As podiatrists, when we do our biomechanical examinations, we often look at foot posture and foot deformity, and often we look at these through a static situation, and very rarely what happens during actual gait. And as there has been a lot of scientific evidence that during static situation and during dynamic function, things can occur very, very differently in the open kinetic chain and the closed kinetic chain situations that we refer to normally. So what we do most of the time is we tend to ignore muscle action, and it's like looking at a car without an engine. Why? Because the muscles provide the motive force. It provides our forces that enable us to move, and so they are a very important component of gait. So whenever we want to answer the question, what are the muscles doing, the benefits of EMG become very apparent. EMG allows us to look at the electrical activity responsible for muscle contractions and to measure muscular performance. And through EMG, we can look at various muscles, both in the lower limbs, in the foot, and throughout the whole body. So the important thing to note is to know when do our muscles activate throughout the gait cycles. And if we look at this diagram by Perry, we're looking at the dorsiflexors, the dorsiflexor muscles. We can see that they mainly fire and function during the first part of the gait cycle and throughout swing, while the plantar flexors, which is those muscles whose tendons pass behind the malleoli, okay, they function mainly through distance phase of gait. Then we also have the inverter and the everter muscles. So for each and every muscle, there is a sort of pattern which we can see once we normalize it to the gait cycle. And that is something that we can compare to any data that we get either from a patient or from a participant or a subject in a research study, that we can compare our patients' data to normative data. So this makes it a bit easier for us to interpret this data. So as we know, our EMG probe picks up the muscle electricity that occurs during muscle contraction. And we know that there are many of these signals that together form one signal. Okay, so we have what we call the raw EMG signal, which if we decompose that signal, it becomes many hundreds of signals which are composed together to get our EMG signal. So if we look at this chart, application and benefits of EMG, we look at medical research, look at orthopedic surgery and functional neurology, posture and gait analysis, rehabilitation, physical therapy, there is ergonomics, and there is sports science. And for me, one notable lack here is where is podiatry? So typical uses of EMG in the medical field for gait analysis, in rehabilitation and in the speech therapy, in surgery to see the effect of surgery on muscle activation. Looking at sports biomechanics and performance, physical therapy, looking at feedback, biofeedback, for example. In engineering, EMG is used in robotics and prosthetics, brain-machine interfaces, and other human factors to study. In this case, for example, we see someone pressing a mouse. So we can actually look at the muscles which are contracting to press that and move that mouse. So practical medical application involving EMG use in a pre and post-surgical assessment and treatment, prevention or retardation of muscle atrophy, relaxation of muscle spasms, maintaining or increasing range of movement, muscle re-education and rehabilitation through biofeedback. We know that there are two types of EMG, the needle EMG and the surface EMG. We know that needle EMG is slightly invasive because we have to insert an electrode in a muscle so that we can get a good signal. But several muscles can actually be measured by using surface EMG, and that means the attaching of a sensor onto the surface, onto the skin, so that we can pick up that signal. And I think through surface electromyography, we can see the signal, and that signal can help us in our evaluation of the patient, and maybe the evaluation of any intervention, such as orthosis, or maybe rehabilitation, or trying to re-educate specific muscles. And we can see the effect directly using EMG. There are various EMG equipment that can be used. And in our lab, for example, we use a 16-channel system that allows us to have up to 16 sensors, which can be attached to the patient's feet or lower legs, or those muscles which are of interest to us. There are also portable systems which one can take out in the field. And this EMG equipment, again, as I said, there are various, and I'm not here to do any advertising for any manufacturer, make it progressively easier for us to use these, to do these EMG tests. We must be careful that the skin is prepared well beforehand, before using before going to use our equipment. So the electrode contact must be stable, so it must not move around. Skin impedance must be minimized by removing any oils, through the use of alcohol swabs and the use of fine sandpaper to abrade the skin surface, because as we know, our skin is covered with keratotic skin that, as much as possible, must be removed before putting on our electrodes in contact with the skin. Also, very important, besides having a very good contact of the sensor onto the skin, that we know that the sensor is really placed where it should be, so that we get the coverage of the muscle we want to cover. For example, what we are seeing here are sensor placements on the upper leg, and these are derived from an organization known as Senium. So if anyone is interested in this, so they can go to senium.org, so that you will know exactly how and where to place your sensor, depending on what muscle or muscles you want to study. For example, here we see where to put the sensor of the rectus femoris, vastus medialis, vastus lateralis, biceps femoris, and semitendinosus. And then maybe of more relevant to us, the lower leg, the tibialis anterior, the peroneus longus, and the peroneus brevis. And they really make it very easy for us, because they show us anatomical landmarks and the distance where to place these sensors relative to these anatomical landmarks. Okay, we can see, for example, here where to place the sensor to measure the soleus and the medial and the lateral head of the gastrocnemius. Okay, so when we do our recording, we do get what is known as a raw signal, which, as I have said, is the summation of many axioms that are firing, and you get one signal that needs to be processed and needs to be analyzed, so that we can remove any noise, any artifacts that might be incorporated in our signal. However, if we follow these two things I have said before, the skin preparation, careful skin preparation, and careful skin and careful placement of the sensor onto the position which we know is related to a specific muscle, we can get a cleaner signal, a much cleaner signal. So this is the raw EMG signal, which will show us the amplitude and the frequency content of our EMG signal, which is useful when studying the activation timing of a muscle, or for verifying the quality of the signal and detecting signal artifacts. The root mean squared is a mathematical process that the most software will do automatically, which represents the mean power of the signal and provides an amplitude envelope, which makes it easier for us to view. So instead of seeing many squiggly signals, we will basically have an enveloped signal that makes it very much easier for us to interpret it. As you can see, this root mean square has removed the negative component and provided quite a smooth signal from which we can get two main two main information here. One relates to the timing of the activation, so when a particular signal started to be sensed. So basically, when that muscle started activation, for how long that activation period was. So in these two signals here, we have two activation signals, and we can see that the timing of the first signal is much shorter than the timing of the second signal. Also, there was a period of no activation in between. So timing is very important to allow us to, for example, compare the activation of that muscle in relation to the gait cycle. Okay? Another piece of information, which is also very important, is the amplitude, is the magnitude of the information, of the signal, which, although it does not really mean the force which is exerted by that muscle, it does give us a relative number which can be related to the force that is being, or which can be related to other muscles, for example, how strongly these muscles can be activated. We must be aware of artifacts in our signal, and these artifacts can arise from, for example, power line interferences. Our labs are full of computers which can actually interfere with the signal. There are also movement artifacts which can also be present. Movement artifacts, we have to remember that our patient or our subject is moving as he or she is going throughout the gait cycle, and if our sensors move, they can cause an artifact which we can erroneously think that it could be an EMG signal. So obviously what I'm saying here is that we need a lot of preparation in order to be able to obtain a good signal and in order to clean, filter, and then interpret the signal. So it's not something that can be done, by everyone, like, you just get an EMG and just start using it. Obviously, our students, for example, those students studying for a master's in clinical biomechanics, all go through training on how to do EMG or how to do research with EMG and so forth. So I can see that a lot of time has passed. So I don't really want to take a lot of your time. So it's already like 20 minutes have gone. So the analysis is very important. We can look at amplitude analysis, temporal analysis, and other types of analysis. I'm hurrying up. Okay, we have talked about amplitude.
Sorry, Dr. Gatt, sorry, 1 minute to finish, please.
Okay, so I will hurry, just show you my screens. And again, where is podiatry? Why is not podiatry on the list? And research has shown us that foot orthosis can affect frequency components of muscles activity, okay? And this research has also shown us that foot posture influences EMG activity of selected muscles. I would like to close by looking at a paper by one of my PhD students, Erica, which will be this colleague will be presenting something later on, and we have shown that in peripheral arterial disease, muscle activation is significantly affected. Okay, so it is very important not to forget these patients and basically not just to relate any problems in diabetic patients with just with neuropathy. And to close again, what about the future of EMG in podiatry? I think I will just start this video. Oops, I will go back. I will, if I can, I will just start this video by, I don't know if it will work. Sorry, it will not work, so forget about it. Please think about EMG as one of another modality that we can incorporate into our clinics, and we can get a lot of valuable information through EMG. Thank you very much.
Thank you, Dr. Gatt. Due to the lack of time, we haven't got questions, but it is a very interesting item or topic for us, for the podiatry in general. So thank you very much.